Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
So Jeremy Hunt is staring down the barrel of a junior doctor strike as he looked to change the way they work to ensure full 24-hour, 24/7 hospital cover. Is the British Medical Association, the doctors' union, being belligerent and awkward? Is Jeremy Hunt just pushing his luck, riding roughshod over doctors' wishes? Or, as Giles has been finding out, and our guest knows only too well, is there something about health reform itself that always means it's a struggle to pull off?
The Secretary of State for Health is responsible for the health of the NHS and much more. But whilst many in the public wish they were just a caring doctor keeping the system ticking along, and doctors wish they were just visitors securing budgets but basically keeping out, politicians in the health hot seat seem to see themselves as surgeons, having to cut out waste, improve outcomes and change systems. So why do they always seem to find reform so hard?
The public and the political class and the media get more worked up about health issues than anything else. Any Secretary of State finds that he or she is embroiled in constant battle with one group or another. It requires a great deal of reform and change to keep up with changing demands and so on. Every time you want to change something, it is fought bitterly by some interest group or other. And the people who are most resistant to change are the general public, who want a better health service but don't want it varied in any way from that with which they're familiar.
Of course, no health secretary is going to get away without upsetting some healthcare professionals, and that's only going to amplify if you're embarking on major reform, to the point where you may have to change your mind or reduce your ambitions. Doctors and nurses tend to be more trusted than politicians, but does that make them better at running health?
Politicians get slagged off, but the skills of a politician, I wasn't a heart surgeon, I wasn't an anaesthetist, I didn't have those skills, I wasn't there to do that. Some of the worst ministers have been doctors, by the way, because they thought that was their role to do that. My job was, as a politician, to weigh up the politics, to go and get what people wanted through Parliament in terms of Acts of Parliament, etc., to argue within government for the right budget.
There could be any number of reasons why reforming or changing the NHS can be tricky. It is, as an institution, held in very high regard by the public. Could be healthcare professionals resistant to change because they think they understand how it works better than the politicians do. Or could it be something to do with politicians themselves?
You do some things at the start that you probably wouldn't do at the end, and you definitely do some things at the end that you definitely wouldn't do at the start. And so for me, for example, I went through a journey personally where you're trying to stabilize the system because it felt out of control. So you set a lot of targets and did a lot of performance management. And then you come to a realization that only gets you part of the way, because what you've got to do is actually you've got to devolve power and give it away. And by the way, that's the hardest thing for a politician.
To really shed light on why health reform is hard, it's all three of these factors sticking the knife into your plans and reducing your life expectancy in the job.
Well, joining me now, Dr. Claire Gerardo, a GP, former chair of the Royal College of GPs, and of course we still have the former Health Secretary, Andrew Lansley. When you look back at your health reforms, was it worth a candle?
Yes, because, I'll just give you one example. Last October, Simon Stevens, as Chief Executive of NHS England, published the 5-year forward view, which was essentially the NHS speaking for itself and saying what it needed over the next 5 years, which actually was then the basis of every party's approach to the general election, and subsequently has been the basis on which the government has planned its funding in response to that. Now, without my reforms, there wouldn't have been an NHS England. There wouldn't be an independent voice for the NHS. And that is reflected in every part of the country in clinical commissioning groups with clinicians themselves taking an increased responsibility for the service that they run.
But part of the problem was not only did the public and commentators not have a clue what you were trying to do, most of your parliamentary colleagues didn't have a clue what you were trying to do.
You're being hard there, because actually the Conservative Party in the House of Commons supported it root and branch, and the peers in the House of Lords, every Conservative supporter.
But they often vote for things they don't have a clue.
The point is, Andrew, we got it through. We got the legislation
Well, of course you got it through, because it was whipped through. And even then you had several problems with the Lib Dems. The problem was it was difficult for voters to understand what it was you were trying to achieve. To this day, I suspect most people still don't really have a clue what it is you did.
Voters didn't understand what was happening back in the early 1990s when there was the Conservatives' internal market. The voters didn't understand in the early 2000s when Labour was bringing in foundation trusts and the like. I remember Tony Blair going out and apologising for not being able to convey what was happening in health reform. The truth of the matter is, the public have never understood how the NHS is run, because from their point of view, what actually matters is their NHS good or not? Is it high quality or not? From my point of view, I think the most important thing, if I have achieved anything, is to give clinicians and the NHS greater devolved power. That's what Alan Milburn was saying at the end of his time. That's what you have to do. You have to give it away. I gave that power away, and if I am right, in 10 years or 15 years from now, people will not have come back and constantly changed, as they used to do, the structure of the NHS.
All right.
They will focus on the quality and the outcomes.
That's a fair point in the sense of the longevity, isn't it? That there was a huge row over the Lansley reforms. They were deeply unpopular with the profession in the NHS itself, and unpopular with the public in the sense that they didn't really understand it but were worried about it. But they're not really an issue now, are they? I mean, they're there. That is the structure of the NHS now.
We haven't stopped having reforms or changes or reorganisations even since Andrew's Act went through. We've had constant changes. The problem about the NHS is that every Secretary of State that comes in wants to fiddle with it, rather like taking toys out of a box and play with it. And no sooner have they fiddled with it, they pull, and to use another analogy, they pull a growing plant to have a look at the roots to see if it's working well. And then, of course, they wreck what they've set up. I'm having, as many doctors, nurses, whoever, having to live with the effects of what's been going on. We're having to live with the effects of an increasingly fragmented health system, of one where we have waiting times that are getting larger by the day, longer by the day. We're on the brink, hopefully not, but we're on the brink of the first junior doctor strike for 40 years.
I'll come on to that in a minute.
And my own profession, Andrew, my own profession, far from having power and authority thrust upon it, we have never been so bad as a profession. So whilst I do accept, Andrew, that the NHS England and formation of NHS England was actually a very good idea, and I also accept that you have the NHS at heart and you firmly and honestly believe in it. I think that the reforms that we had put the clock back by a number of years. We were already moving towards integration. We were already moving towards large organisations that were capable and competent enough to commission.
How could you have done integration without the legislation? Because things like the health and wellbeing boards, I mean, everywhere I go, local authorities and the local NHS are saying we are working together in ways that we were never able to do previously. And the health and wellbeing board and the public health responsibilities shared with local government has created a capacity to integrate services which never existed before.
Andrew, I've been a GP in the same practice, fortunately, for nearly 30 years. We had better integrated care 25 years ago than we have now. We had a workforce then of a police officer that would come in, a benefits advisor, housing officers, community development, district nurses, midwives, I can name them. They may have been funded through different routes, but we all worked together, sharing a record, sharing patients. We had better integration. I used to go into hospitals, do ward rounds on my patients with the hospital consultants. We worked towards integrated stroke care.
But you know why that all broke down? It broke down because of the way in which the NHS used to be managed.
It broke down
because the primary care trusts never talked to anybody.
They did, Andrew, and to be fair, and to be absolutely fair, and I don't want to get into an argument, to be absolutely fair, when we, in 2010, primary care trusts were just beginning to work together to get to be larger organisations, much more competent.
Larger is not necessarily better.
They were much better because you could get competent people in. So I think it's slightly disingenuous, and it's not that I take away your commitment, but it's slightly disingenuous to say to people like me who carry on with the day job in a really difficult situation that we welcome this.
Should Labour, I mean, Labour fought, at the time Labour said they would unravel them. Should they still do that, or is it just too far gone?
Well, if we don't unravel, then we're setting in stone and fossilising some of
So you would unravel?
Listen, I'm not a spokesman for Labour, but there are certain problems which are really quite complicated with the current systems and structures of the NHS, including the fact that we have your entitlement to healthcare is whether you're registered with a GP, not dependent on your geographical area. So there are lots of problems that are going on.
Let me ask you this, though. If you look at the reforms that have been made to the NHS that governments have attempted of various hues, the Thatcher government, Major government, Blair, Brown governments, now this government, particularly under Andrew Lansley, have the major representatives of the health profession, have they supported any of these reforms?
They have actually, and cast your mind back to fund holding. Now, right at the beginning of fund holding, the majority of the profession weren't in favour, but as fund holding went on and as it matured, we were very much...
But you did oppose it to begin with.
We didn't oppose fund holding per se, we opposed the inequities that were being brought in. But if you're asking me, are there...
Actually, you've been against, not you personally, maybe you have been, but the BMA and other big organisations, every reform has been opposed by them.
I think you're probably right, but that doesn't mean that actually, if you allow things to evolve, you end up in the right place.
Let me just quickly tell you a story. I remember a head of the BMA who sat in a big meeting with me and he said, well, we don't agree with the government. And then rather foolishly he went on, but then we've never agreed with any government.
We'll leave on that anecdote. We'll leave it there, Doctor. Thanks for being with us.